Hi, everybody. I'm Rex from Let's Grow Kids. I'll be acting as the tech host for this session. Please remember to stay on mute if you're not speaking, and feel free to use the chat for questions or use the Zoom hand raise function. I'll be here to help with anyone who is having issues. So for this session, I just want to point out who's presenting for us. Okay, Margaret Atkinson is here. She's Director of Development and Community Relations at Winston Prouty Center for Child and Family Development. And Courtney Farrell, the Director of Child and Family Services for the Lund Family Center. I'll turn it over to them now.
Hi, welcome, folks. I maybe we'll wait like just a minute because we know there's almost 70 people signed up for this and 46 have logged in. But this is the Children's Integrated Services issue area, if that, just so that you know that you're in the right place. And it's lovely to see some of the folks from around the state that I only see at Early Childhood Day and see their faces. So welcome. All right, well, I'm gonna do so if folks have questions, they can put them in the chat. If this was a smaller group, we'd do quick introductions, but not this time, but welcome. I'm going to share the screen. Come on, and Courtney can start with us whenever she's ready.
Thanks, Margaret. I did just want to start by acknowledging that we do, I see that we have senior leadership from CDD here, which is great that you all can join us. So the interim deputy commissioner, Miranda Gray, is on IC, and Sheila Duranolo, the CDD director of programs, I believe, is also joining us, I see. And this is a large group. Okay, so Margaret, you're gonna, as best you can, monitor the chat because I will get easily distracted by that. But if people have questions as we go, we definitely wanna make sure that you let us know. And I think if you raise your hand, we probably won't see that. So possibly the best way to let us know if you have a question is in the chat. Would you agree, Margaret?
So whoops. Oh, goodness. Am I muted or not?
No, you're not.
Okay. So what I would say is because I'm screen sharing, Rex now has to monitor the chat because I can't see it.
Okay.
But that's why we have Rex. So, okay, we're set to go.
Okay.
Thanks, folks.
And so just looking at who's on with us, I do know that a fair amount of people who are in this workshop are either CIS providers or work closely with CIS in the system of care. So a lot of these first kind of pieces are really just an overview of CIS. I think maybe not new information for a lot of you, but felt important to identify as we talk about CIS. So CIS is a unique to Vermont way of supporting early childhood and family systems. And it really is a noteworthy innovation in terms of the delivery of evidence-based, informed, and integrated services for families in Vermont. The model is really an important piece of it is that it requires CIS providers in the system of care not only to cooperate or collaborate, but to integrate the care that they provide for families. And so that really is a key piece when we talk about children's integrated service, that there's kind of a progression of how we work together as a system, and there's cooperation and collaboration, and integration really is the high end of services coming together. So prior to the implementation of CIS, Vermont families often found themselves burdened by multiple home visitors or other early childhood care providers, often in their homes or going to those providers, so multiple different appointments across the system. Oftentimes, they also experience contradictory plans of care. So each of those individual systems was obviously writing and developing plans of care with families. And when the system is not integrated, those plans are unfortunately at times can be contradictory and set families up. Additionally, prior to CIS, regions didn't have integrated data. Right now with CIS, while we acknowledge that there are definitely data issues and pieces that the system knows that we need more of related to data, because of the way that CIS is delivered and put together in regions, we do have integrated data across our system of care. And that's something that we're able to look at on a regular basis. Next slide, Margaret. Okay, so CIS offers 4 core services to families of young children facing challenges. And those 4 core services are early intervention, sometimes also called Part C, specialized childcare, early childhood and family mental health, and then Strong Families Vermont home visiting, which does, that category does incorporate both nurse home visiting and then what we sometimes refer to as social work home visiting, or not, sometimes non-nurse home visiting. And then in the middle of that is a key piece of CIS, and that is the service coordination. So each region has a one-door approach and a CIS coordinator who receives referrals, manages that referral process out to the different providers, and coordinates this system. Okay, next slide. And then more to what I was just speaking about, the structure of CIS, both at the state and the local level, includes a CIS state team, historically in Waterbury, that provide oversight of the program and support. The fiscal agent contractor for each region is a single entity, and that region receives and manages the funding for CIS. And holds the contract with the state. The regional CIS admin team is the coalition of providers and partners in the system. And that team really governs our regional CIS system and ensures service delivery. Then the local CIS coordinators are the individuals in each region that we spoke about that coordinate with the different partners, ensure reporting, and all of those coordination pieces of the system. And then the regional intake and referral team, CIS, one of the ways that we deliver services in an integrated way is that there are weekly meetings that bring together all of those CIS providers with the coordinator. And at those meetings, we triage referrals and further work on collaboration with families. Next slide. And I think for anybody who works within the CIS system or is closely connected to this, this is not information you don't already know, but it's important. So the prevention and early intervention services that that compose CIS have immediate and long-term benefits. CIS focuses on whole families, and that's a really important piece of CIS as well. Obviously, we're working with young children, and young children don't come to service on their own. They come to service with their families, and often the best way we support young children is through supporting their family. So we focus on whole families, we focus on support of children's social, emotional, and cognitive development, family preservation, stability and unification. And then also support parents' contribution to Vermont's workforce. So helping families with young children who are experiencing challenges often can be a reason that contributes to the families needing to leave the workforce. And so the more that these services can support and enhance that, there is a contribution there as well. And then I think further CIS services enhance and improve outcomes that are complementary to DCF family and economic services, which are also often systems that families that we work with are also connected to. And then further, you know, an important piece of what the system also contributes to is the longer term outcomes, especially for children as they transition into the public education system. So in an era of concern over the per student cost of K through 12 education, CIS really does aim to support children before they reach the school system, providing effective interventions to developmental issues that we all know are more costly as children grow when they're not addressed early on. Next. This slide really kind of goes into more the value and purpose of the model. So the upstream services provided by the CIS system, again, we use, you know, because we're family centered, we use a multi-generational approach for maximum impact. Key being that we are working with whole families in whatever way families identify. Research demonstrates that quality interventions and support for children 0 to 5 have among the highest return on investment across human services. So really our ability as a system of care to focus our early prevention efforts in that 0 to 5 age range demonstrates one of the highest return on investments in all of human services. CIS uses multiple evidence-based practices with proven effectiveness in impacting outcomes in health, child maltreatment prevention, education, and economic well-being. And our services also help to mitigate ACEs and intergenerational trauma. Thanks. So it felt important to also just talk, going back to that piece in the first slide about why integration is important. And again, highlighting that integration really is a higher level of systems working together than you know, collaboration or just coordination. And so what we know about services for early childhood and families when they're integrated is that there is ease of service access for families. So CIS uses a one door and often also a no wrong door approach, which really does allow for pretty seamless entry into the system of care. Also ease of referral for other providers. So in our state, we know that pediatricians are some of the part of the system that most frequently interface with all young children and families because we have a great system of care for young children, or system of healthcare for young children. So when pediatricians identify a need for further assessment or service, we know that their ease of being able to make those referrals into one service coordinator who then ensures that the appropriate referrals are made eases their referral process. We spoke about this a little bit already, but integrated plans of care really do help reduce duplication and contradictory services for families. Again, the way that CIS is set up and delivered in Vermont, this is one key piece of that we do use that one care model, and we do have integrated plans of care across the system. So we really are not setting families up for duplication or contradiction. Again, the availability of regional data across the system, that is a key piece of integration, and the way that the CIS system is supported in coming together under our integrated contracts and funding also allows for us to have integrated data. And that's an important, although I would say the statewide data is not, it has room for improvement across the system. We know that regionally, the data that providers in the system are able to receive and look at on a regular basis to understand the needs of children and families in their system happens only because we do have an integrated system. And then regional decision-making about our funding priorities and allocations are another key piece of this model and really happen because the system is integrated currently. Next slide. So now we're really going to transition into the funding challenges with the system, where our work group is with our ask in the legislature this year around CIS, and then, you know, some information for you all to think about in terms of your conversations with legislators. But before we transition to that, I just wanted to make sure there were no questions related to any of the pieces we've already talked about. Okay, good. Okay, so the CIS funding does use a bundled rate methodology. Prior to payment reform, and we'll get into that in a little bit, what payment reform is, each regional CIS contract total was based on historical spending among the service providers before they bundled. So the methodology for determining rates in each region was really based on historical numbers and billing prior to that, and so there needed to be some more work to get equity across the system for each region. So regional case rates at that time were determined by contract total and set monthly client count and monthly case rates. And at that time, really what we were seeing was that those case rates across the state ranged from anywhere from 498 to 854, with a mean of 676 across the region. So again, there wasn't a methodology that ensured equity in that rate, and it was really driven by older, out-of-date historical numbers. So when the CIS bundled payment methodology was designed to allow admin teams to allocate funding across their services on a locally determined methodology, community need, and provider capacity. The reimbursement for bundled services for the state, also the way that it's set up, those reimbursements can exceed what our contract totals are. So when we have a contract that gives us a cap in our region, if we end up having a higher need or serving more children based on that methodology, we don't get paid anymore. We're capped at that state contract total. So related to all of this, since its inception in 2009, when CIS first started, the program has been level funded, which, as many of you know, that translates into annual funding decreases for providers and for the system as a whole, as the money that's then available each year doesn't cover the annual cost of living increases. Additionally, because there have been inconsistent regional rates based on that historical funding prior to bundled payments, when regions were seeing changes in their need, the funding was really not addressing that anymore. So, you know, I think, again, most people know this, but what that all translates to when the system is not well funded is that we see delayed services in terms of timeliness indicators. We're suffering, and specifically with early intervention Part C, which is a federally mandated program, the state started to see impacts there in terms of our federal compliance. In inadequate capacity, which really impacts delayed service, we know that the resources available for CIS in general cannot keep up with the increasing population need. This also leads to staffing shortages because we, as a CIS system, weren't able to pay wages that keep people in the system. We have a piece of data here. It's from 2016, and unfortunately I couldn't find anything more updated, but at that time, 64% of CIS staff had been with CIS for 5 years or less, and that was up from 50% in 2016. And then, you know, all of this also leads to a crisis-driven model. So the idea of CIS is that we're really focused on early intervention and prevention, and inadequately funding the system really moves us to a more crisis-driven, reactive system of care, which is not where we want to be. So in 2019, the state initiated a payment reform process, and the goals for CIS payment reform at that time were to develop updated payment methodologies to reflect current cost of service delivery and the population need, as well as utilize the methodology to implement a statewide base rate with appropriate regional variation. In 2018, the Child Development Division of DCF paid independent consultants to study the CIS reimbursement rates and make recommendations. And for any of you who are CIS providers and were at that time, you probably remember that process that we all went through. At the end of that study, the consultants' report revealed that the rate that was being offered under the current contracts at that time, which was $512 per client per month, did not cover the cost of providing what we needed to provide in the system. So their rate study indicated at that time, again, this was in the 2018-19 time range, that the cost actually for delivering CIS would be $634 per client per month. In the fall of 2020, there had been a different plan for initiating this payment reform, and then COVID happened and things kind of got delayed a bit. But in the fall of last year, payment reform did begin to be initiated. And so at that point, we transitioned to a consistent rate across the state for all CIS, and that rate is $517 currently. And again, just reminding people that the rate that the consultants established at that time was $634. So when that went into place, some regions experienced less. Some regions experienced loss, while some had an increase because of that disparity that had already been in place. Okay, now we can do the next. So our work group that's been working with the Alliance that consists of a number of CIS providers across the state, we've been working on the advocacy around CIS for the past couple of years. And so each year we have a specific ask. When the rate study happened, that really made our ask pretty easy because an independent consultant, studied the system and the cost and was able to demonstrate what the true cost of the system would be. So we really do align with that in our ask. I think what's important to know in what we've been working on in our ask is that we have been working with the legislature to advocate that CIS be at a level that would cover the cost of providing the services, which really is going back to what the rate study established. However, also considering that the study data is over 2 years old now, we are encouraging that an inflation adjusted rate would be more appropriate at this point, which brings that rate then in the ask up to $667. And again, that's the per member per month rate. And so what that means as a statewide CIS funding is that the budget increase for CIS across the state would be that 3 million range. This, we believe, would allow the 12 regional nonprofit agencies that deliver CIS to continue to meet the needs of children and families, which I think everybody here knows is more important now than ever for young children in our state. So one update we also wanted to give as the legislative process has been underway this year, the House Human Services Committee was the first committee to kind of receive our information and the state's information and really wrestle with the funding of CIS. And so when they developed their February 19th budget memo to the House Appropriations Committee, they did note that they were recommending an increase to the CIS line in the state budget. So their particular recommendation was an increase in the CIS case rate from 517 to 600. Again, that's not the ask that we've made, but it is very close. And this is pretty significant progress in our advocacy work around CIS funding. So that's really what we put together for our overview of what we've been working on related to CIS funding advocacy. I think we wanted to make sure to spend some time answering questions that people may have and just helping people think about how you frame up your local story and what your experience is with CIS funding and challenges, knowing that you know, the next part of today after this workshop ends is your opportunity to talk with your representatives and how you might frame that up or questions you might have about having those conversations.
Thanks. And I just want to add, those of you who have members of House Human Service Committee in your groups today, to please take the time to thank them for advocating for that increase. It's a really, I mean, it's not everything we want, but it's like an incredible validation of, you know, our work and you know, the place and the system needs. So you know, there's more work to be done, but getting them to recommend that $600 figure is huge. So yay. But there's plenty more to be done in House appropriations, and you know, as all the many early care and learning, you know, topics move through the State House this year, we don't want this to be lost. So questions, if people want you know, to share their stories. I mean, again, using the local examples and your local stories is the most powerful method of connecting, because you know, folks, that's how people connect. So questions, comments?
I have a question. This is Nancy Bloomfield. I'm from the Hartford region, from the Family Place Parent Child Center. We're the fiscal agent for our region. And just to open up a can of worms here, I'm just wondering when any of you have been having conversations with your legislators about this ask, how have you been weaving in the governor's proposal to dismantle the Child Development Division and unintegrate, for lack of a better word, the CIS services? Because I think you did a really nice job, Courtney, talking about how important, what the reasons for integration and what integration looks like, and that proposal, there's a proposal to take some of those pieces, make some of those pieces less integrated. And I don't want to steer this conversation away from the CIS ask, but I'm just wondering, when you've been having conversations with legislatures, how have you managed talking about both of those things, or how has that been working? Because I have a feeling that might come up in our lunchtime chats.
Yeah, thanks, Nancy, for asking that question. I think, we for sure anticipated that would be a question that might come up in this workshop. And I think it is hard to say that that isn't a part of the conversation. I think our focus for this is really talking about how the current CIS system works for families and children, and what the demonstrated need is in terms of funding. I think there are similar conversations that are happening about the governor's proposal, and that's not in the forefront for us right now. We're really focused on the funding ask for the current system. Floyd might have a comment.
I might. I actually have several paragraphs of comments, but it's important to note that what the administration has proposed to date doesn't deal with any of the policy changes. What it does is it deals with where the money goes, right? So all they have done is said, we're going to disaggregate CDD in order to put the money back into these places where it came from. But we have no plan for how we're going to provide integrated services in the future. So, and until they present that plan, this thing should be dead on arrival.
In a previous workshop, the one that I was just in before this topic came up specifically, H394, I think is the one that's the governor's, it's the thing that puts the governor's plan into action. It's apparently crossover date. Most of you probably know what that is Friday. The belief from the previous people is that there's just zero way it's going to happen, at zero way it's going to get passed by Friday. There's also not a lot of legislative support for it either. So just that's what I heard in the previous workshop is related to your question, Nancy.
Yeah, thank you for adding that, Wendy. I think, that's, many of us are hearing similar things. And I think until we know differently that it's possibly going in a different way, again, our focus has really been about, we have a current system in place. It's called CIS. It is about integrating services, and it's underfunded. And that is our ask. And that's what we're focused on for right now. Should things shift with the governor's proposal and that becomes more likely, then there will be more conversation about that. But right now, we have a system in place and it's underfunded. Floyd.
My apologies, but I think that it's important to acknowledge that this is the administration's intent. This administration is more interested in making life easier for the business office at AHS than they are in making life easier for the families we serve.
Courtney, I had a question. I just wanted
Sure.
to just confirm. So since House Human Services sent that positive budget memo, the focus now is on House appropriations and Senate
Health and
health and
welfare.
welfare? Yeah.
Yeah.
Okay.
And
Yeah.
one of the things that has been noted about the budget memo from House Human Services is that, in past years, they've prioritized their suggestions to House appropriations, and they did not do that this year. I think a lot of that is connected to the fact that there's still going to be another tranche of coronavirus relief funds coming into the state, and there's in some more, I guess you would say, theoretical leeway in the budget. So, and I think it was also that they, as you know, had a lot of other bills stacking up that needed their attention. So they did not prioritize. So I feel like that's really up to us, the citizens, to, help folks understand that this suggestion is a priority for the constituents here. That's, our voice can really matter this time because we can make it a priority.
Margaret, this is Lee Lauber in Montpelier, and I wonder if there's anyone on the call who has been following the House Appropriations Committee to have a sense of how receptive they are to the recommendation that they got from Human Services.
That's an excellent question, which I don't have an answer to right now. I personally have been trying to follow as much as I can, but that may be a good question for Matt or Dan Brown from the Alliance, who are in those Zooms all day long. There's Dan Brown's face. He might have an answer for us.
Yeah. I'm still relatively new to this issue, but I can say big picture that it did not receive the red carpet treatment when it was in committee. There was lots of people that had some pretty deep questions about it across all three major political parties. So there's lots of questions about it, I'd say.
Could you give us an example of what one of those questions might be?
Well, yeah, so I feel like one of the questions was the impression that this policy would disintegrate the integrated services, and lots of people had questions about that.
Right, but that
the change of funding, or the change of funding, where I think Lee was asking about the funding increase suggestion.
Right, so the HHS budget memo that recommended an increase in the CIS funding. Do you have a sense of the response from House Approps to that so far?
I have not been following House Approps closely. That is a question for Matt. I apologize.
Yeah.
I think it's good news that it's a good news that the others, that the H394 was not welcomed either. I mean, I think that's also good news for us. But
Right.
So I think, as you think about your opportunity to have conversation with your representatives or whoever you're able to connect with today around this, I wonder if people have questions. I know with our group, we often have an opportunity to meet frequently and kind of anticipate what the questions are or receive questions back from our representatives and think about how we're answering them. And I know sometimes when you're just having a conversation about the need for funding the system, there may be questions that come up that maybe you don't quite know how to ask. And I think this is a good opportunity to think about what those are or challenges that you've experienced in conversations. I can share one of the challenges that our work group has frequently had is when we're asked to be able to share data about the impact of the current statewide system. That's a challenging conversation because we don't have a great statewide data system for CIS, and being able to share that story through that lens has been a challenge. One of the things we've tried to focus on is really bringing it back to the impact to children and families in our region. So we all have experiences working with young children and families, and can talk about how CIS has supported them in their success. And that is often something that's really helpful in those conversations. But wanted to open that up to questions people may have or concerns you may have about having these conversations with your representatives. Or good experiences too.
Courtney, this is Nancy again. I think that the storytelling is so important, and I also think that that statistic that you shared about the turnover rate is really important too. And when those two things are put together, how important the work is, and I think really describing, helping legislators understand what it takes to do a good job doing that work, how much support, how much training, in some cases certification, things like that, what's required of staff to do that well. And so what it means for the community when there is a lot of turnover. So I think really highlighting that can be very powerful.
Yes, I would totally agree. And I think that's a part of your, each region's story is what has been your experience with turnover and being able to maintain a consistent, strong workforce, which we, I think, all know is impacted by lack of funding.
I know in our region here in Chittenden that, and in my little bubble of specialized childcare, one of the strengths and pluses is having a local presence in our community and really understanding that we're on the ground, we're directly interfacing with clients, and that's important and crucial. And we've advocated on that ground for years and years, and we'll continue to. And one of the things I fear is actually at Child Care Resource on our specialized childcare team, we have longevity. We have not had a lot of turnover on our team specifically, but it's always at risk, and I lose sleep over it because if I lost any of the members of my team, it would be a very different picture in terms of how much work would need to go into doing the work. We're very efficient now because we have the longevity and we have the relationships in the community. So that's a strength that we have. It's very vulnerable, and I worry about losing that. And so whether we're talking about CIS or whether we're talking about disintegration, I think that's what I come back to is knowing our communities, having that local presence, having those relationships with families, childcare providers, and even children when we go into programs is crucial to do the work well and to collaborate with each other within CIS and also with our partners in school districts, et cetera. I think we've worked very hard to do that strongly and well, and there's always room for improvement, and I think we would all agree on that. And we would like to be spending our time and energy on those pieces and be more proactive rather than reactive, as Courtney said earlier.
I would also add that those long-term employees deserve to be paid a wage that honors their expertise and their relationships over time. I mean, we're fortunate in our region to have early interventionist who's, been in the field for, more than 20 years and is just masterful and an amazing mentor for the younger folks coming up behind her. And she is in no way compensated what she is worth in this system. And it's really, if you're gonna build, local capacity, you have to really be able to, bring people in early and build them up and have them have a satisfying career path. And that means pay as well, so.
With this, I need to interrupt. I want to thank everyone for being here, for joining us. this session needs to end, and what's important, everybody understands what's going next. You need to use UVA and the agenda to navigate to your next session so that you can join it as the session, so that you will be able to be put in the right breakout room for the discussion over lunch. So I wanted to make sure that we're clear on that, and very productive conversation. Thank you all, but we need to move on.
Bye. Thank you, Courtney
Thank you, Courtney and Margaret.
and Margaret.